Good morning. This is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator, and you're watching Aging Strong. Aging Strong is sponsored by the Quincy Health Department. Today's topic is on the power of connection. Loneliness is really one of the buzzwords during these times, especially during COVID. And my guest today has been on before. She is the epidemiologist for the Quincy Health Department. Her name is Sandy So. I can't pronounce her first name fully. It's beautiful, but Sandy, please pronounce your first name for us so that way people will know who you
Yes,
are.
that's fine. So my full name is Sopetsuc Sandy. Yes.
Beautiful. So, Sandy, I'm looking forward to what you have to share with us as far as the power of connections. Before you put on your presentation, I know you have a beautiful presentation to share with us. Have you yourself experienced loneliness before, and what have you done to help overcome that, if you did experience it before?
Yeah, I think one of the biggest transitions for me when I experienced loneliness was when I started college. I was pretty quiet when I first started, like just throughout childhood, I was pretty quiet and I wasn't really an extroverted person. But once I started college, that's when I really started feeling a little bit lonely because even though I had roommates and I did have my classmates, I didn't feel like a deep connection with anyone just yet. But what helped me create connections with them is that it's just talking with them and like just getting to know each other. And my roommate specifically was amazing to talk to. We had a lot in common as well. And with my major, medical laboratory science, what I ended up doing was I put myself out there and just started speaking to other people in the classes and seeing how everything went. And there was a lot of interesting connections that I had made throughout those avenues.
Hmm.
Yes.
Thank you so much. Yeah, I can imagine like a lot of college students, especially freshmen, being, forced to room with another person and really not knowing who that person is, or just, some people are just shy and just don't know how to start conversation. And, there's a lot of different dynamics there at play. So, thank you so much for sharing that with us. Sure a lot of people can relate to that.
Yes, definitely. Thank you, everybody, for joining me today. I am from the Quincy Health Department, and my presentation will be on the power of social connection. Okay. So, there is currently an epidemic on loneliness, and based off of the U.S. Surgeon General, there was a report that was written. These are some of the quotes that I got from that report that I wanted to highlight in regards to the epidemic of loneliness and isolation as of right now. So the first bullet was our epidemic of loneliness and isolation has been an underappreciated public health crisis that has harmed individuals and societal health. Our relationships are a source of healing and a well-being hiding in plain sight. Help us live healthier, more fulfilled, and more productive lives. Quoted by the Surgeon General, Dr. Vivek Murthy. Also, given the significant health consequences of loneliness and isolation, we must prioritize building social connection the same way we have prioritized other critical public health issues, such as tobacco, obesity, and substance use disorders. Together, we can build a country that's healthier, more resilient, less lonely, and more connected. And here is just like a little statistic on loneliness in Massachusetts. I obtained this from AARP. They do have a loneliness program. So you can see that in the area. So I'm just going to highlight like Quincy specifically, which is around here, as you can see from my mouse, I believe. Yeah. So we're within like the 22.5%, as well as the lowest percentiles is the lowest percentiles in this area. But this is by county itself. So you can see like Norfolk County right here. Yes, it has like less than 11%, but we are pretty close to Boston area, which is also like 22.5. There is a stark difference, but this is by county, the loneliness percentage scores.
Sandy, what do you think accounts for that? these areas like Quincy, Boston, and the surrounding towns seems to have a higher rate of loneliness compared to the ones to the north or to the south of the counties.
It could probably be, I think there's a lot that goes into loneliness, such as like your physical health, your mental health, as well as just like the resources and the environment that you're living in, and whether or not you're able to, for example, transportation, whether or not you're able to go to like the gym or the senior center, whether or not locations are easily accessible. Um, there could also be like whether or not I know some homes don't have Wi-Fi either, and I know in this day and age, there's a lot of like internet-based, Wi-Fi-based connections that you can make socially on like social media and things like that. But if you don't have Wi-Fi at the home, or if you're not able to access Wi-Fi, it is really hard to get in touch with others. I think it's mainly just access and environment, as well as like you yourself. If it's hard for you to like get out of the home for any specific reason, it would be hard to engage in physical social connections at that.
Yeah, yeah, good, very good points. Yeah.
So I would like to define social connection, and this definition is from the U.S. Surgeon General report. So social connectedness is the degree to which an individual or population might fall along the continuum of achieving social connection needs. Social connection itself is a continuum of the size and diversity of one's social network and roles, the functions these relationships serve, and their positive or negative qualities. So from this little infographic that I had obtained, it shows that lacking social connection is one of the biggest mortality comparisons compared to like smoking up to 15 cigarettes daily, drinking such alcoholic drinks daily, physical inactivity, obesity, and air pollution. Lacking social connection is one of the biggest things.
This is a very interesting slide because the terms social connectedness and social connections, they seem like they're the same, but they're different, right?
Yes.
Yeah. And so the social connectedness, it depends on the individual.
Yes, it depends on the degree of which the individual population might fall. So it's how much you feel connected to in an individual or a population. Where social connection itself is like the size and diversity of what is around you. So you may have social connections, but you may not feel connected. Yes.
Yeah. So it's the perception of the individual. They might have a lot of they might be, a part of many groups, knitting groups, walking groups, cooking groups, reading groups.
Yes.
But if that individual themselves don't feel like they're deeply connected, then they still kind of feel like an outsider maybe, or a lonely. Yeah. Okay.
Yeah. All right. So social connection as medicine. So social connection is beneficial for individual health and improves the resilience of our communities. Evidence shows that increased connection can help reduce the risk of serious health conditions such as heart disease, stroke, dementia, and depression. Communities where residents are more connected with one another fare better on several measures of population health, community safety, community resilience, when natural disasters strike, as well as prosperity and civic engagement.
Love it.
All right, so social connection and health. So the three vital components of social connection based off of the Office of the U.S. Surgeon General is structure, function, and quality. So structure is the number and variety of relationships and frequency of interactions. Some examples include your household size, your friend circle size, and your marital or partnership status. Function is the degree to which relationships serve various needs. So for example, emotional support, mentorship, support in a crisis. And the last component is quality. So the positive and negative aspects of relationships and interactions. So these examples are relationship satisfaction, relationship strain, social inclusion or exclusion. So these are the biggest main vital components of social connection, and you need to have all of these qualities, well, all of these components in order to have a social connection and whether or not to feel social connectedness. Right. So the absence or lack of social connection, there were a few studies done in regards to absence or lack of social connection and how that can impact the people. So according to Holst-Lunston et al. 2015, living in isolation reduces our chances of survival, and social isolation increases the risk for premature mortality by 29%. That's like a very large, I think that's a large percentage. Another study, according to a study performed by Voltorta et al. 2016, poor social relationships, social isolation, and loneliness can increase your risk of heart disease by 29% and the risk of stroke by 32%. And another study, according to Brinkhus et al. In 2018, smaller social network size is associated with an increased risk of type 2 diabetes and of other diabetic complications, including heart attack and kidney disease. So I want to say, is that the absence or lack of social connection, it does impact health in a great way, just because if you think about, for example, if you want to try to eat healthier, usually it's easier to do that with another person, having them as a support system through your journey, whether or not you're going through a disease, whether or not you're going through any mental illness, or anything else that may be, traumatic or what's happening in your life so far. As long as you have a support system, I think that's what helps you as an individual could get better or get worse, depending on how that connection goes.
Yeah. I really, it's amazing to me how negatively social isolation, no, actually loneliness is what the word is, not social isolation, but loneliness, how it can really negatively impact our health and well-being. It's just, and your previous slide, loneliness being almost like toxic, because the title of the slide was social isolation as being, a medicine. Social connection is medicine, which is so powerful because we don't really think of being lonely as something that can negatively impact our health. And it's something that's so insidious. You can't really see it, just like, as opposed to if you were to see somebody smoking or eating a lot of fatty, salty food, you could tell that person is going to in some point in their life is going to have some sort of a, and their health will be impacted. But as far as loneliness goes, it's just so quiet and you just kind of see it in the background and you don't see the compounding negative effects of that particular way of living or dealing with society. But it's just amazing. It's amazing. So I just wanted to.
Yes, I do agree with that. Because loneliness and social isolation, I think the main difference is that loneliness is how you feel per se, in regards to whether or not you are being isolated or whether or not you are not. Because you can still feel lonely even in the presence of others, depending on your mindset, really. But social isolation itself, though, there are environmental aspects that can put someone in social isolation. For example, if you are homebound, if you're sick, or if, you can't go out there for accessibility issues or things like that. Anything that may be hindering you from being able to actually go out and socialize. And again, like I said, like if you don't have Wi-Fi in the home, you can be isolated in that sense as well. But loneliness itself, I think it's more of a mindset. I think it's whether or not you can overcome that feeling of being left out or feeling by yourself, things of that sort.
Yeah. Well said.
All right. So the presence or abundance of social connection. So there have been studies that show that having more social connections does help with health. So according to studies done by Cohen and Willis back in 1985, as well as Southwick in 2016, being more socially connected can improve stress responses and minimize the negative health effects of stress. Another study that was done by My Health, My Community in 2018, people with strong perceptions of community belongingness are 2.6 times more likely to report good or excellent health than people with a low sense of belongingness. And according to multiple studies performed, social support from friends and family is associated with improved hypertension and diabetes management. So you can see that having that support system really does affect your mental as well as your physical health overall when you are dealing with anything, when you're dealing with life in general. I think it's really important to have social connections and feel connected to these people that you are interacting with in order to feel better about yourself as well as about the world around you. And it's about life in general.
Yeah. That's great.
So I wanted to highlight the social connection over time. Again, this graph was from the Office of the U.S. General Surgeon. So even though we have an abundance of technology, overall, our lack of social connection is increasing. So for example, you can see that social isolation, there was an increase of 24 hours per month from like 2003 to 2020. And again, this data is also during like the COVID pandemic period. So we have to understand too that during COVID, there was just a big social connection and like social isolation. And then for the second graph, you could see household family social engagement decreased about 5 hours per month. And then companionship is a decrease of 14 hours per month. Social engagement with friends, there is a decrease of 20 hours per month. And then non-household family social engagement has been a decrease of 6.5 hours per month. And social engagement with others, there's a decrease of 10 hours per month. So overall, you can see that there has been a decrease in social engagement in general. And it's actually very interesting because before, like probably back in the day, you know, everybody had to write letters instead. They had to do telephone lines if they had telephone. But now we have such an abundance of being able to be connected via the internet or via just driving vehicle as well. But you could see that there's still a decrease in social engagement and social connection over time, which is alarming. And I think that's why the U.S. Surgeon General really wanted to highlight this epidemic of loneliness that is happening in the U.S. and trying to help communities combat ways in which to increase social connection within communities.
Yeah, it's really, I can't wait to see in maybe 10 years if the researchers from the U.S. Surgeon General, if they were to compare this statistics and add it on to like 10 years from now, would the trend be going up or down, or is it because of COVID that the trend has gone up in some areas and down in some areas? It would be nice to see how people kind of rebounded or became resilient, maybe, hopefully, after the pandemic, because you know, it's just the metrics here are just very concerning.
Yes. Yeah, like you can even see like I would be very interested too in the next like, you know, 10, 20 years. And even with our technology growing as well. Because like you could see from like this graph right here, the social engagement with friends. You can see that, you know, there was a pretty high number of hours. There's 60 hours, you know, per month back in 2003. And if I remember correctly, I'm not too sure if the internet was there at the time. You know, I think the internet really started in 1995. I'm not too sure, like 2000, like there was like a big boom, 2008. I'm not too sure when the internet started myself, but you know, there was probably, it's interesting to see that at 2003, there might not have been a robust Wi-Fi or robust internet at that time, but there was still such an increase, higher number of social engagement with friends at that time versus now, and probably that's why as well, because the COVID pandemic really did do a great deal, especially on like the children and adolescent population, because school is a big social group for them. And for them to not be able to physically go to school, I think it really impacted the children and the families a lot in regards to that.
Yeah. And also, I know at the beginning of the decade, well, actually, no, the beginning of 2000, the year 2000, that's when
Yeah.
the mobile phones were just starting to become popular.
Oh,
So,
okay. Mhm.
right, I believe. And so if that's the case, then perhaps, I don't have the statistics, so don't quote me on this, then perhaps micro moments of social connections may be occurring through text and email instead of in-person connection. And maybe that's why there's a perception of a decrease in a number of hours. Because if you could send a quick text to somebody, it may not be, or maybe it is perceived as connection. Way different from, meeting somebody for coffee and spending 30 minutes with them or an hour with them, or, walking with them around the park or whatever. If you could text somebody and say, hi, how are you doing? I don't know.
Yes.
I don't have the stats, but it would be interesting also to see what other factors might have contributed to the decline in social engagement when it seems like people are on the phone a lot these days, texting somebody, even when they're around other people having coffee at the table, they're on the phone, maybe texting another friend. There's so many different factors at play. And it's just very, very interesting to be able to see some of the trends and the influences.
Yeah, I agree as well, because I think with all the new technology, it's really like, okay, so what do you define as social engagement? What do you define as digital engagement? And like, what is the degree in which you do feel engaged with those avenues of connection, but I mean, the Office of the U.S. Surgeon General did define social engagement in the actual report. I didn't put it on the slide yet. I didn't put it on the slide though, but they do have definitions um, for each of these terms that are being used.
Yeah.
All right. So there is a bunch of factors that contribute to social connection. So I know this is a really like busy figure, as you can see, but feeling a social, being a socially connected human, there are community, organizational, interpersonal, society. So you could see that these are the biggest things that go into feeling connected. So, for example, housing, environment, education, work, employment, health, leisure, nutrition, and transportation. And all of this is connected via the lifespan and the diversity and equity, as well as the evidence and application of all of this in the community. But you can see everything is connected as well. You can see that education is connected with leisure. You can see that health is connected with transportation. Work is connected with yourself specifically. And then like housing is also connected with work, because people will tend to try to have a social connection or their environment to be close to them physically. A lot of people try to find work that's close by. They try to find a hospital that's close by. They try to like engage in groups that are close by, especially if they don't have transportation. So if, for example, if you're living in the city, majority of people don't use their own personal car, and they probably will use public transportation, whether or not, access to public transportation is easy via a bus on their street to the T or things like that. But really, there's a lot that really goes into being socially connected. And I think there also is a lot based off environment, as well as just life and what happens throughout life for you and your social connections. All right. So one of the things I wanted to highlight was social connection and longevity. So in 2004, Dan Boutnier, CEO of Blue Zones LLC, was determined to uncover the specific aspects of lifestyle and environment that lead to longevity. So these areas that he studied were dubbed the Blue Zones, where people reach age 100 at 10 times greater rates than the United States. The five Blue Zones here are Loma Linda, United States, Nicoya, Costa Rica, Sardinia, Italy, Ikaria, Greece, and Okinawa, Japan. I apologize again for saying any of these wrong. But yeah, so these 5 areas were studied by Dan Boutnier, and he found that there were multiple things that went into how they had longevity. So let me go to the next slide. So these are the 3 things that was based off of connection for the 9 principles that were found during his studies. So in regards to connection, having longevity, one of them is putting loved ones first. So centenarians spend a lot of time and effort working on their relationships with their spouses and children. And children are likely to keep their aging parents nearby and to consider them to be fonts of wisdom that will favor their own survival. So again, it seems like a lot of these locations, the familial bond were pretty strong and they tended to stay nearby or live together. The second form of connection was belonging. So people in Blue Zones tend to belong to a faith-based community. Individuals of faith who regularly attended a faith-based service live 4 to 14 years longer than their counterparts who do not, based off of Boutnier's research. And the third aspect of connection was right tribe. So health behaviors are contagious, which is what Boutnier said, and deleterious behaviors, example, obesity, smoking, excessive drinking, loneliness, unhappiness, are also contagious. And the world's longest living people curate social circles around themselves that support healthy behavior. Again, we are people and we are influenced by others very easily, I think, whether by family, by friends, by community, anything that's really around us, we are impacted and affected. So I think a lot of this holds true for any community out there, but you can see that having these connections, at least for the 5 areas of the Blue Zones, they had very strong connections in order to basically have longevity in their communities.
Yeah. I find it very fascinating and also it's inspiring to know that there are parts of the world that are considered to be living in the Blue Zone. At the same time, I just feel like, I'm disappointed that there's not as many. In the United States, there's only right now the one in Loma Linda in California. And that particular, it's not even the whole part of Loma Linda, right? It's almost, It's just one little section of Loma Linda. And those are the group that's considered Seventh-day Adventists. And they are very spiritually based. And a lot of what they do, including profession, their hours of work are they uphold those based on their religion. Like they can't after a certain time. And also I believe their diet as well is, they have a healthier diet. So, it's very inspiring to me to have areas that are considered Blue Zone and wondering how we can bring some of those types of qualities into our own communities. So that way we don't necessarily have to be a 7-day Adventist, but what are they doing right that we can start doing at home, in our own home, so that we start touching upon the factors of, loved ones first. What can parents start doing now for their children so that hopefully when they get older, we foster a strong relationship with our children and hopefully, there's no guarantee that, our children will be there for us, whether they live out of state or not, will be able to support us as we get older. Yeah, so there's just so many. I find the blue zone concept so fascinating, and I always try to look for different ways that we can kind of cultivate some of those qualities into our lives, to share with other people too, so that way they don't feel like, okay, I don't live in those areas. That's it. I'm doomed. I'm not going to
Yes.
live after, I'm only going to live up to 70 or 80. Other people in the blue zones are living up to 100 or 120.
Yeah, I believe that if if communities were able to delve deeper into the blue zone research as well as looking at, I think it really is structural change within the, local towns or cities, as well as the state, whether or not we're able to, everything ties in. Like, for example, nutrition, want to make sure that we have healthy, nutritious food available for people because nutrition is a big portion of maintaining physical health. And I think one of the things I also wanted to highlight was that aspect of like a third place. So, for example, like the places that we are in are, the home, the work, and hopefully a third place because I, I think a lot of these places that did have longevity as well is that these people did have a third place. For example, majority of them felt like they belonged in a faith-based community. Some of them, that third place could be, like the coffee shop down the street, a meetup with the men's group, a meetup with the women's group, whatever that third place is, because depending on family dynamics, the family it could be good or bad, depending on family dynamics and how those relationships work and work as well too. It could be stressful or not stressful depending on how your work is, right? But that third place, I think that's what really hits home is that you want to make sure to have a third place to feel there, to feel seen and to feel happy and healthy. And I think that's the importance of having a third place. And I think that's what's lacking as well in some communities is that there's no accessibility to a third place. People don't feel the need of a third place because also from working from home, for example, now I have the home. So for example, I'm working from home today. My home itself physically is my home, but also my work. So that already makes two places into one place. So again, I think there's a big aspect in regards to a third place and how that impacts your social connections and how you feel about being connectedness and whether or not you're loneliness and stuff. So
Yeah, I love that. I love that. It does make so much sense because these days, a lot of people are choosing to work remotely, which is, wonderful. But at the same time, creating boundaries around where you're going to, hold your work hours, at home is very important, but still you're not able to extract yourself from the built environment, the
yes,
home. So having a neutral place where you can feel kind of when you can let go of the responsibilities of work and maybe the responsibilities of family and just kind of be there for yourself and feel seen and heard as a person is so important. Yeah. And, what would that look like for people who are very private, very shy, and, more likely to experience loneliness? What would that look like? Would it be just kind of be sitting in the mall and people watch or do grocery shopping and, striking up a very quick, innocent conversation with somebody on the line? At least there is that, interaction, with another person. Or maybe just going to church, right? Some
yes,
people, yeah. So it's very fascinating to me. And it's, what I want from, our time together is for people who are experiencing loneliness, maybe they feel lonely, maybe they are not aware that they have been lonely and they've just been feeling depressed and down. Hopefully they can get some sort of an inspiration or maybe an idea to try, or ideas to try. If one doesn't work, try another idea. So that way they're at least feeling like they're doing something, that they don't feel helpless, which can perpetuate hopelessness, right? and
Yeah.
then a downward spiral of, poor health and well-being, and then even more feeling lonely. So that's, I'm really enjoying this conversation. I really appreciate what you're sharing with us.
Oh, thank you. Thank you. Yeah, I do hope that people do get to learn more about, loneliness and social connectedness. And I think that's a good transition to the next slide, if I remember correctly. So what can you do to increase your social connection? What can you do? So these, this was from the US Surgeon General. So the first thing that you can do is invest time in nurturing your relationships. You want to make sure you reach out to your friend, who's probably long distance or something, have a good phone call with them for an hour. Number two is minimize distraction during conversation. So when you are physically with someone, maybe mute your phone, put your phone on silent, that way you minimize your distraction from your phone as well as any other distractions outside. For example, if where you're at, the music is loud, maybe you want to turn it down. So just minimize distraction during conversation. Number three is participate in social and community groups. So a lot of people, again, have community groups include like religious groups, as well as any other like community service groups, anything that you're really into, like a knitting club, a book club, or any type of club or group that you're interested in your community. And number four, seek out opportunities to serve and support others. So again, this is volunteering work. It will help you with feeling better about yourself and feeling better about reaching out to the community and being able to support others during your time. Number five is actively engage with people of different backgrounds and experiences to expand your understanding of and relationships with others. And I think this really holds true to the USA because we are a melting pot and we can learn so much from many different people from all different backgrounds and experiences. So again, learning about others and how they live, how they play, how they work is one of the biggest things to engage and understand how relationships are with others and your perception. Number six is be responsive, supportive, and practice gratitude. So again, I think one of the biggest things for this is, being able to listen as well as being able to open yourself and be vulnerable. I think that's the biggest thing about being supportive and responsive to others when you are trying to have a deeper social connection. And again, I think the biggest thing is gratitude. I think we should all practice gratitude in some form or way because just being grateful of the life we live and being grateful of the engagements that we have is a big thing in regards to your mental health and can impact your health a lot. And number seven, reduce practices that lead to feelings of disconnection from others. So for example, if you're feeling down and you just want to stay home, it's okay to stay home. It's fine to do that. But if you're staying home for 5 days straight and not being able to go out there, maybe try to reach out to someone, and that goes into number eight, seek help during times of struggle. The biggest thing is that we are very individualistic, I feel. And for some people, they don't feel seen or heard. And it's very hard to seek help during times of struggle because people are afraid to put their hand out there. But again, I think people should try to alleviate that fear and understand that humans are social creatures. We should be able to help out others and we should be able to lend a helping hand whenever. And number nine is being open with your healthcare provider about significant social changes in your life because some of these social changes can really impact your health. So I think one of that, again, it's hard to be open to your healthcare provider depending on some people because, like for example, my mother, she did not like the healthcare providers at all. It was hard for her to open up about her own life and things like that. So I think it's really big just to be able to be vulnerable with others. I think that's one of the biggest takeaways as well for what you can do to open up your social connections. And then also, how can you connect as you get older? So one of the data points that I got is 1 in 4 adults age 65 and older are socially isolated. And that's a big number, 1 in 4. That's a lot. So let's So I think one of the biggest things about getting older is think about your connections plan. And like a connections plan could be, when you're feeling down, what are the steps that you are going to take in order to get yourself out there, like out of that place of thought. So your connections plan might be like, okay, well, I went to the doctors today. I didn't feel good about what they said today. So I will call my friend, at 5 o'clock to talk to them for 30 minutes about what happened and see if they can help me feel better. So a simple connections plan as such. Who is your go-to to reach out to? Who is your go-to to reach out emotionally, mentally, physically, anything. The second thing is foster connections with family and friends. Make time and schedule dates. So as you get older, you may be in retirement, there might be a lot more time on your hands, but if you have children, your children might be busy with work or things like that. So you could try to foster connections with other family members. So for example, like the summertime, if you have grandkids, you could try to go over their house more, hang out with the grandkids, as well as, if you have any friends like that you want to reach out to, maybe plan like a friends group, like a cruise or something, or even just like a walk, like a daily walk in the park at 10 a.m. I think scheduling and making time is the biggest thing to help foster connections, especially with this day and age, because everyone's very busy. Everyone's go, go, go all the time. So it's hard to really just step away from that go, go, go. Another thing is phone a friend, write letters, send emails, try to connect using any communication strategy. So again, we have our cell phones. If you still like to write letters, you could always write letters. You could send them out. It will just take a little bit longer, but at least you have a pen pal at that point. Sometimes it's better to write letters too, because that way you have that physical ability. If you have the physical ability to write letters, you're able to give 1 hour of your time for yourself in order to write a letter to someone and really think about them and think about that connection that you have. Or send emails. You could send an email as well, similar to writing a letter, but an email is just via the internet. But yeah, trying to connect using any communication strategy. Another big thing that you could do is check out local community centers, like such as the Council on Aging or senior centers in your community. So again, as you get older, I think a lot of these community centers are for adults ages 60 or above, I believe. And again, if you are in retirement and don't have really anything to do, you might garden in your home for a little bit. But if you want to go to like a aerobics class, at the Council on Aging, for example, in Quincy, we have Council on Aging, and they have a bunch of different programs there. Like there's exercise classes, there's luncheons sometime, there's movie night, there's movie days. There's a lot of different programs to help you engage in the community. Mm-hmm. And another thing too is explore social groups and support groups. So again, your social groups may be on the Council on Aging community. Your other social groups might be your book club that you meet like every Friday night or something. You guys want to choose a book, read it X amount of time. And also what you could consider too is like a 55 plus community. Like you can consider moving to a 55 plus community, especially if you're like in the suburbs and you are far away from any like community centers or social groups. You might want to move closer to a 55 community or inside a 55 plus community. That way you are able to connect with others in the same age group as well. And, for example, one of my friends, her dad is, I think, 63 now, and he has a home in Florida as well in a 55 plus community. And he is always staying physically active. He's always going out with his community there. And I think that's amazing to have because it's really good to foster the social connections to help you keep on moving or to help you with your mental health as well as just like your social status in general.
I love it. You shared so many wonderful ideas for people to just connect and to do during the day, because sometimes people may feel bored and not think about, okay, what can I do? So your connections plan is a great idea. I love that. So people can just sit down and think about what they would like to do, what they have available to them in their community, or even close friends, what they could do during those days when they're feeling extra lonely or even bored. I love that. And fostering connections with family and friends, that's so ongoing. That's just it's ongoing. I mean, like you mentioned before that there's some families, their relationship may be not as strong as another family. There's no perfect family, right? And so having that third place to go to, like you mentioned before, very, very important. And writing letters and sending cards out, it never gets old. It's all nice to get something in the mail, right? And just to read it and because it makes you feel like, okay, somebody took an extra time to get the card or write something out to send me this message and to, go to the post office and mail it. That takes some time. That takes time and a lot of thought and consideration for a person to do that. So it's really amazing. And of course, checking out the Council of Aging and Senior Centers. There's always something to do there. I'm just so amazed at how robust senior centers are, as far as offering Zumba or having, sing-alongs, or there's always something going on in every hour, whether it's something for, like maybe just a piano that somebody can sit at and start playing, or maybe a puzzle on the table, somebody can start, putting together some pieces, or maybe a Zumba class happening, or a yoga class, or an accounting class. There's so many different dynamics, and I really do appreciate all the senior centers out there because they have something for everybody.
I agree. I think the senior center, especially like the Council on Aging in Quincy, they really do a great job in tailoring specific programs for everyone's interest. And a lot of the seniors there too, they have to pick and choose sometimes because they like both. They like Zumba, but they also like the arts and crafts happening at the same time. So it is hard to juggle as well. But I think it's great that they have just like a variety of things for the community. Yes.
Yeah. Yeah. Sometimes, as you know, I do a lot of workshops in the community center and also the senior centers. And I love it when a participant would say to me, I have to leave your class a half hour early because I need to go to the next class, which is, Tai Chi, or there's a pickleball game that's about to start. So I want to join that.
Yep.
I love it. I love it.
Yes, I do love that too. It's amazing because I used to do the Way to Go class back in the day for the Council on Aging, but some of them would say that they would be like, oh, like I need to leave 30 minutes early because I want to go to the weight training class that's starting in like 30 minutes. And I was like, oh, that's totally fine. Like I'm glad that they are trying to make the time for all of their interests,
Mm-hmm.
Yes.
Yeah, and in the workshops that I offer, I recently just completed happiness for longevity, because it weaves in a lot of the principles that you mentioned here, loneliness and social isolation, and how when we feel connected to a group or to somebody, meaningful relationships is one of the predictors of a long, happy life. And that is based on a longitudinal study from Harvard, that's basically says if you have deep, meaningful relationship, that is one of the predictors of a happy life. And so, creating programs, that has, elements of connection and also flourishing for older adults, having them converse, getting into, asking questions, pair shares, and having them talk within amongst themselves about their past experiences and how that has fostered some level of resilience or happiness in them. I find it creates a deeper, meaningful conversation, both during the programs and also after. So as I'm, packing out to do another workshop, another location, I enjoy seeing the conversations that the ladies, the men are having after the program, because I know that whatever they just experienced in the workshop, they're carrying it forward, and it kind of helped foster another level of relationship. because it's just, again, it's so important to connect people. If it's something, if you can't, if a person's not able to do it themselves, I feel, at least for myself, when I do my workshops, when I offer my workshops, I built in time for people to, turn to the next person, everybody has 1 minute to share how's that experience for you, and give the other person a chance, so that way people are having moments where they feel like they're being seen and heard, and that kind of, in a way, inherently creates some sort of a level of relationship building,
Yes.
amongst each
A
other.
connectedness.
Yeah,
Yes.
connectedness. So, I honestly, I love seeing the participants continue their conversations in the hallways, and then in the following class, them sitting next to each other, because then I know, okay, something has clicked here, and, they're finding, some sort of an enjoyment, with each other. So I love that.
I do agree. It's awesome to see conversations outside of the workshop. And it's really amazing, even let's say you're walking in the mall and you're like, oh, I saw those two at the workshop and they're at the mall together. I just love seeing that
Yeah.
with communities and with people.
Yeah. I
Yes.
love it. Love it. Love it. Love it. Yeah.
So how can the Quincy Health Department help? So we have Facebook and social media postings all the time. Um, we always try to put out we have a health newsletter as well, monthly. And on Facebook, we try to just post some fact sheets out there for people for resources, things like that. Currently at the farmers market, we do have a farmers market table, not every Friday, but we are there once a month. So you guys can always reach out to us at the farmers market table. We have in-home flu vaccination programs as well for people who are homebound or cannot leave the home for any flu vaccination. So we do have that program. So if you need, you can call the nursing office for that. We also try to connect individuals to resources. If they need housing resources, we'll connect them to whoever, to the housing department. If anybody else needs resources for food, for example, we'll connect them to the food banks, things like that. And then Quincy Health Department also has various programs with community partners, such as what we are doing now. And we try to have a lot of meaningful topics for those various programs for the community. So these are some ways in which the Quincy Health Department does try to foster social connection within the community. But always give us a call if you do need anything. And this is also the Facebook QR code right here. If anybody wants to scan, follow us on Facebook. For example, the heat wave right now, we have a heat advisory. So we put that out.
Mm-hmm. Yeah. 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 The Quincy Health Department they do so much for the whole community, both at the departmental level and also in the homes. Like you said, you would nurses would go to people's homes and check on patient, I mean, on the person, just to make sure they're okay, or even doing the vaccinations. It's wonderful.
And I also want to highlight national and state resources. So the U.S. Department of Health and Human Services, you can reach them at that website. The National Alliance on Mental Illness, Massachusetts, the Foundation for Social Connection, your local Council on Aging or senior centers. There's also Little Brothers Friends of the Elderly in Boston. They do reach out to the community. So you can look at that. And then there's the 988 Suicide and Crisis Lifeline. If you are going through anything, please call that number if you feel the need to. So these are national, state resources, as well as some local resources as well. And here are my references for the presentation. And I would like to thank you again for joining me today. And if you have any additional questions, please reach out to the Quincy Health Department Nursing Office at this number.
Sandy, this has been great. This has been great. I really appreciate you sharing, this information with us. So, uh, as you come off the screen share, I just want to ask you a couple of questions before we end this program. What, you know, what are three things? What are three things that you want people to take away from this program today? And what is one quick and easy thing to do for people who are really desperate to connect with somebody? What is that one thing?
To answer your first question, I think the three takeaways that I would say is um, being able to be vulnerable. I think that's one of the biggest things is being able to understand that you are feeling lonely, that you are in social isolation, and then being able to be vulnerable with others to talk about that, you know, and that way you can foster that connection. I think that's one takeaway. I think another takeaway is that we do have abundance of resources around us. And you could reach out, phone a friend, reach out, phone a family member, whoever you want to reach out to. Who's your go-to person? Think about that person. I think the third takeaway, I would say is just have fun. I think that's the biggest thing. I think a lot of people stress about work, stress about family a lot, and they try your best to just have fun with everything, And I think the number one thing that people could do that can help them like take themselves out of loneliness or social isolation is like again reach out to that one person, because I think even though we feel lonely, even though we might feel alone, I think we still have one person that we could reach out to, whether it be it could even be someone who has passed on as well. Think about that person, like even though they passed away, if they were a big portion in your life, you can still think about that person, and that could help alleviate your loneliness as well, you know? So I think just think about that one person, reach out to them if they're still there. If not, then reach out to your second person. I think the biggest thing is just to reach out, because people are afraid to reach out sometimes.
Wow, that's great. So basically the message is be vulnerable and just keep it up. Just keep connecting with somebody, right? So I love that. I love that. So I really appreciate everything that you've shared with us today. It's just it's such an important topic. Again, unlike obesity, the pandemic has really perpetuated so many different types of levels of loneliness out there. So, it's something that you can't really see, but eventually it's going to take a toll, and, it's going to be very noticeable. And again, comparing it to people who are smokers who, you can see that there's something that's going to happen to their health in a negative way, maybe somewhere along the lines, but with loneliness, you can't really see that until sometimes it's too late. So I really appreciate your, information that you shared with us. So, until next time, everybody, I want to, encourage you to listen to this show, look at the resources that Sandy has shared with us, and try to create your own, companion. Is that what you called it? The
connections plan.
Yeah. Yeah. Create your own connections plan. Make it fun so that, you could do something for yourself, by yourself, maybe creating a goal, or having, doing it with somebody, maybe, because you never know, another person may be lonely in your circle and they might not be aware of it. So, just doing something for you and for other people would be a great way to connect. So, Sandy, again, thank you. And I want to thank the Quincy Health Department for sponsoring this program. Until next time, everybody, have a great day and stay safe. Bye-bye.
Thank you.